Food insecurity in Baltimore is complicated and multi-layered. There are lots of places where people have access to food, but there are lots of places where people do not. Baltimore is populated by lots of food deserts, where people don't have access to food. Baltimore is populated by lots of food swamps, where people have lots of access to unhealthy food.
With regards to food insecurity in Baltimore, we know that 1 in 3 school-aged children are living in food insecure households. We also know that that's approximately the same rate for childhood poverty in Baltimore City, and over 70% of our students come from households who are participating in the SNAP benefits program. They're eligible for Medicaid or the temporary cash assistance program, or they're participating in the foster care system or are experiencing homelessness.
The purpose of Maryland Hunger Solutions is pretty straightforward. We want to end hunger in the state of Maryland and improve the nutrition in the state of Maryland. And we do that not by touching food. There are plenty of people who do that, from farmers to farmers markets to grocery stores to the charitable space with food pantries and food banks. We do it by using policy and advocacy and connecting to be able to utilize the best as we can of the existing food programs that are out there.
Michael J. Wilson and I were both at the Baltimore Food Advisory Council. Michael J. learned that I was an evaluator, and he came to me and he said, "We have this great opportunity. All the kids in Baltimore are being fed. How do we evaluate the impact of that? There must be a way." And I said, "I think there's a way." And that became a start of a great conversation between Michael J., Maryland Hunger Solutions, me and my department, and the School of Public Health.
The research that we were able to do with Dr. Gross is very important because Maryland was one of the first states to do community eligibility. Baltimore was one of the first big cities. And the research showed that not only does it help food insecurity for students in schools, but it also has a broader impact on food insecurity in the community.
All students are eligible to receive free meals through us. We know that over 55% of our students are eating lunch every day, and between breakfast, lunch, snack, and supper, in the 22-23 school year, we were serving about 69,000 meals every single day. Over the course of that school year, it was more than 12 million meals.
Our research from Baltimore City influenced Baltimore County to adopt community eligibility for all their schools who are eligible. And then our research on the policy on summer meal waivers was heard by the legislature.
Maryland Hunger Solutions they're an advocate. They're a nonprofit organization, and part of their mission is to advance good public policy that will alleviate hunger. And their credibility is boosted by the research that is completed by Johns Hopkins. And so as a policymaker, it's something that I can rely on.
The Henrietta Lacks Memorial Award will help with future research partnerships between Maryland Hunger Solutions and Johns Hopkins by helping fund our research interns that we have shared over the years.
To be associated with the name Henrietta Lacks is intimidating in and of itself. The challenges that we know that she had, that her family had, that many people, especially in the African American community, have had, as epitomized in her life. I am proud to be associated with that, and I am intimidated to know that we have much more to do to make sure that everything she did and everything she went through is not in vain.